There's been an increase in COVID cases in Arizona and around the country this summer. ER visits and hospitalizations are on the rise. Joining us now is Will Humble, Executive Director of the Arizona Public Health Association. Will, good to have you here. Thank you so much.
Thanks, my pleasure.
What are we seeing with COVID here in Arizona?
So just like every summer for the last few years, we're seeing an increase in the spread of the virus. The best way we can measure that these days is with hospitalization admissions and then with emergency department visits, because like the case numbers that we used to talk back in 2020, 2020, we just don't really know what case numbers are. It's not really being reported, and people are doing the home testing, which doesn't get captured. So really ED visits and hospitalizations are what we're tracking, and they're ticking up in Arizona. Actually, they're twice as high as the rest of the country, but at a low baseline.
Okay, so high, but not all that high.
Well, 2%. So
Okay.
2% of inpatient hospitalizations and emergency department visits in Arizona over the last 3 weeks have been for COVID-19. So 2%, way different from earlier in the pandemic.
Almost entirely this KP3 variant?
I'd say more like 80%.
Okay.
And then the J series, they're all Omicron viruses. But yeah, most of it's this new KP3.
The KP3, compare that to the previous strains.
Just like it has been, each iteration gets more transmissible than the last. That's natural selection. They're trying to find new hosts, these viruses are. And it's no more lethal. It's hard to say that it's less, people are less symptomatic with this new version, but it's more transmissible. And because you can't take over unless you're more transmissible.
Right.
Yeah.
But you can take over and not be as lethal.
Correct. And that's the general pattern.
Right.
Right. Natural selection pushes towards things that are more transmissible and less lethal because the virus just wants to make more copies of itself. That's it.
So with that in mind, the booster shots that will be available, I would imagine, this fall, will they focus on KP3? And
Yes.
what do the previous boosters do? Does KP3, is that affected at all by the previous boosters?
Well, so they're what they try to do is to keep up as best they can with the virus. By the time, who knows? By the time the vaccine comes out in October, KP3 could be displaced by something new. But they're trying to keep up with the antigen. That's the protein on the coat of the virus, and craft the boosters to, as best they can, what is circulating when they're making it.
And if it's not a perfect match, it's still better than nothing.
Way better.
Yes. CDC is recommending maybe the COVID shot and the flu shot at the same time. That a good recommendation?
Well, in public health, one of the things they try to do is to not miss opportunities. And one way to not miss a vaccine opportunity is to get people once. Because you have one visit, you get them both. If you spread them out, you're more likely to say, well, I got one and then I didn't make the appointment for the other. So that's really the reason, is just uptake.
Public health impact of what's happening right now and what could possibly happen come cold weather time.
I think a rerun of 2023 probably, maybe a little less than that. Mm-hmm. We have this summer, increase in infections. And then starting in Thanksgiving and those next couple months is a much bigger wave of infection. It's been that way from the very beginning. 2 bumps, one in the winter and one in the middle of the summer.
Interesting. All right, public health impact. We talked about that regarding COVID. I want you to compare the public health impact of COVID with extreme heat.
Okay, so good question. So right now, if you look at emergency departments and inpatient hospitalization, but especially ED visits in Maricopa County, about 4% of people coming into the emergency department are there because of heat stress, either dehydration or overexposure to the sun in one shape or form. And as we talked about earlier, about 2% of people are coming to emergency departments for COVID. So at least in the lower deserts part of Arizona, there's twice as many people going in for reasons of overexposure to heat and not drinking enough water than for COVID right now.
Yeah, and heat deaths in Maricopa County apparently are up now, even more than they were last year when they were up big time.
And what's really troubling is to look at the number of cases or deaths under investigation. So you can look at the Maricopa County website and you say, well, there's been 20-some deaths, but they have way over 300 under investigation, and most of those are going to turn out positive for that was the main cause of death. So, I mean, we're perhaps on, I mean, part of this is what happens with the weather, but looks to me like we're on track to be the same or even worse than last year. And, you know, heat was in the top 10 causes of death in Arizona last year.
I think it was number 6. When you said investigating, though, whether or not these are heat related, I mean, what is a heat death?
So you'd have to bring a medical examiner on the show.
Yeah.
But there's things that they look at and tests that they do, to figure out, okay, this is primary heat death.
Okay.
But they also, on the death certificate, it's not just one thing. So it's like, could be cardiac arrest. Was heat part of that? And so you have to establish the main cause of death. Drugs, substance abuse is part of it. So what's the main cause of death and then what contributed? So they sort that out during this investigation phase.
Last question here. I know there's supposed to be state heat officers and county heat officers and these sorts of, is that making a difference at all?
Well, I think we'll see at the end of the year. I mean, I know, here's one thing about, is it going to make a difference? You can't really compare one year to the next because the weather's different, the distribution of people are different, the resources have been different. I mean, there's more heat relief centers. The cities have done more work with that, the counties, the Maricopa Association of Government. So there's a lot more stuff happening, but even with those additional interventions, it could end up that we even do more poorly this summer than last.
Yeah, and before you go, are we better prepared now? Are we better prepared for a serious COVID or infection outbreak than we were prior to COVID? Are we better? We got to be better prepared. Come on now.
Okay, here's the thing. I think the medical and public health system is better prepared, but if public health were to urge people to take measures like masking, I think compliance would be poor.
Yeah, it would.
So you could say, so that's a
all right.
Tough answer.
All right, I
Tough
tried, Will. Will Humble, Arizona Public Health Association. Thank you so much. Always a pleasure.
All right, take care.